Hello, everyone. My name is Devjani Das. Just a little bit about myself. I am a physician. I'm an attending physician and an associate professor of emergency medicine. And I currently work at Columbia University Medical Center in New York City.
Thank you so much. We're so delighted to welcome Dr. Devjani Das. Then I would like to ask the first question. Could you share any thoughts on nurses' leadership from your experience working and training nurses or students?
Sure. So I would say that I have always worked very, very closely with nursing, both nursing students and nursing leadership throughout my training and beyond. I would have to say that the emergency department functions a little bit differently than a lot of other parts of the hospital. We work very, very close, both in proximity and with patients. And so it's always been a matter of teamwork, working with our nurses and nursing leadership, is what I can say. I would certainly say that very, very early on, we as physicians have learned to always turn to our nursing leadership and also to our nurses to always trust when they have, when they have an opinion on what's going on, if they're particularly concerned about patients. It's always one of those things I remember in the back of my mind, and it's something I teach my trainees, both residents and medical students, is if the nurses have something to say and they're concerned about, you should always listen. Nursing leadership for me, I think, has been a vastly important resource that we have in the emergency department. They really are the ones that resolve most of the issues that we come across. They are the ones that we look to, whether it be allocation of resources, whether it be resolving patient care issues, or even just improving flow throughout the emergency department. Nursing are the ones who do that. So, with us as well helping, but I think first and foremost, it is their department, so they run it. So for me, nursing leadership is of the utmost importance in what I do every day.
Thank you. As you emphasize the importance of teamwork, what do you think are the nurses' role within the healthcare team? Could you provide your thoughts on this?
Yeah, I think that more so than any other part of the healthcare team, nursing and nursing leaderships are the ones that have what you would say boots on the ground. They're the ones that see what's happening in real time. So they're the ones that are most attuned to the needs that we have, the issues that we may come across, and the potential solutions that may help to mitigate some of those situations. So I think that when it comes to making decisions, particularly, I mean, I've only ever worked in a hospital setting, but particularly in a hospital setting, nursing leadership are the ones that truly can see what the issues are, and therefore are the ones that come up often with the most effective solutions to some of those issues.
So, currently, the world is tackling the COVID-19 pandemic. I'm sure you have a lot of experience working on this. How do you see nurses facing this pandemic, and what would it be their leadership roles during these difficult times?
Yeah, so I think that the COVID pandemic has been something that none of us really have foreseen. I personally, in my training, have never been up against anything like this before. So it's something that's new that we're all learning about. It's new challenges none of us have ever really faced before. What I can tell you about what I've experienced working alongside nurses is that I am particularly astounded by the fact that, the world has come to appreciate healthcare providers and workers, and to say, you're the ones that are the quote unquote heroes and whatever they think about us. But I would say that for a lot of the healthcare team, whether it be doctors or other people within the field, we can easily come in and out of a room taking care of a patient. We see them briefly, we put in orders, we say this is what needs to happen. But it's really the nursing staff that are the ones that are with the patients day in and day out, spending the most time face to face with these patients. So I think that we need to be uniquely aware of that. From from both the perspective of we need to listen to what they've learned from this pandemic, as well as to be attuned to the fact that they're the ones that are really putting themselves, in my opinion, most in quote unquote harm's way, right? You're the ones that are with the patients for the most time. And so those are things that we really need to learn. And to go back to what I was saying about teamwork, I think that applies towards what is happening now with the pandemic, is that, again, it's the nursing leadership that are there. They're the ones that are seeing what's happening. They're the ones that have come up with ad hoc solutions to situations that have arisen on a day-to-day basis, and continue to do so. Every day is a new challenge, and even when we think things are getting a little better, they're not. And so, I think it's a day-to-day situation, but I think it's only just highlighted even further for me, and I know for a lot of others, the importance of what nursing leadership can do and how we need to work together as a team.
Yeah, thank you so much for raising that point. Then finally, could you give us a message to nursing students and nurses who will become future leaders?
Yeah, I mean, I think that I feel like I'm harping on the same thing, but I think it all comes down to working together well as a team. Communication is of the utmost importance, and truly listening, listening to everyone, whether it be a student, whether it be, support staff that work with us as well. It's having that ability to really incorporate what everybody is telling you into what you do on a day-to-day basis is extremely important, because I think without that key element, you'll never be successful in coming up with solutions to the problems that we are encountering. And number two is particularly for students, and I say this for students in healthcare in general, whether it be nursing students, medical students, whoever it is that we work with, is to learn to take care of yourself as well. I think that this particular pandemic, and it's something that I'm passionate about as well, is highlighting the fact that mental health is of the utmost importance for healthcare providers, all healthcare providers. And there's no denying that going through this pandemic is having a significant effect on all of us. And there's already been studies about it. So I would say, first and foremost, take care of yourself. Make sure that you are not trying to be the hero in all of this, and learning what your limits are, and talking to others when you feel that you may have gone past that limit. But those, I think, are my two key pieces of advice: is really work as a team, learn to listen, and to take care of yourself.
Do you have any tips on how to take care of yourself, what you're trying to do right now?
Oh, I am probably the worst at this, and it's so funny because I'm so passionate about it and I talk about it so much. But I would say having support people, right? Having family or friends, people that you can talk to. They don't need to be within the field that you work in. It could really be anybody. And it's just someone that you turn to that is your support person, is how we kind of phrased it. Your support buddy, I think, is how we were doing it. Just having someone check in on you and you checking in on them and saying, are you okay today? Something as simple as that can be profoundly effective. Also, just taking time out to do things. We try to take some time out to just walk outside and just be outside. We do so many of these types of interviews. We're on computers all day when we're not in the hospital or working, and it can take a toll on all of us. So just taking that little bit of a breather to go outside, take a walk, take a break, rest. Those are all very important things. And just having that buddy to talk to, I think, is also profoundly important.
Thank you so much, Dr. Devjani.
You're welcome.